Hello, everyone, and welcome back. We are so thrilled you could join us today because we are tackling a topic that is absolutely essential for anyone living, traveling, or studying in an English-speaking country. Today, our focus is how to speak English at the pharmacy.
Welcome, everybody. This is such a crucial episode. It is one thing to struggle with your English when you are ordering a coffee or asking for directions. If you get the wrong coffee, it is annoying, but it is not a big deal. But when you are feeling sick and you're dealing with medication, clear communication is incredibly important. You really cannot afford to have a misunderstanding when it comes to your health.
Exactly. Being sick in a foreign country is already stressful enough. Your brain is foggy, you just want to go to bed, and the last thing you want to do is try to remember complex medical vocabulary. So our goal today is to give you the exact phrases and words you need so that if you do find yourself at the pharmacy, you can navigate it with total confidence.
Let us start with the basics, beginning with the name of the place itself. In the United States and Canada, you will almost always hear it called a pharmacy or a drugstore.
Right, and in the UK, Australia, or New Zealand, you're much more likely to hear it called a chemist or the chemists. So if someone says, I need to pop down to the chemist, they mean they're going to the pharmacy.
Now, when you walk into most large pharmacies today, you'll notice it is divided into two main areas. There are the aisles, where anyone can just pick things up off the shelf, and then there is the counter at the back where the professionals in the white coats work. This is the first major vocabulary distinction we need to make: over the counter versus prescription.
Let's break those down. Over-the-counter, which you'll often see abbreviated as OTC, refers to medicines you can buy without a doctor's permission. You just pick them up, walk to the cash register, and pay. Things like mild painkillers, cough drops, vitamin C, and allergy pills are usually OTC.
On the other hand, we have prescription medication. A prescription is a formal authorization from a doctor. In the past, it was always a physical piece of paper, but nowadays, doctors often send it electronically straight to the pharmacy. You absolutely cannot get these medicines without that doctor's approval.
Let's imagine you just walked into the pharmacy and you have a terrible cold. You don't have a prescription, you just need to buy some over-the-counter medicine. But you're looking at a wall of hundreds of different boxes and you have no idea which one to choose. This is when you need to ask the pharmacist for advice.
Pharmacists are incredibly highly trained, and they are usually very happy to help you choose the right OTC medication. But how do you ask them? The most common and natural phrase is, could you recommend something for, followed by your symptom?
Could you recommend something for a headache? Could you recommend something for a sore throat? It's a perfectly polite, direct formula. You can also ask what's good for example, what's good for a stomachache, or do you have anything for a dry cough?
Let us quickly review some common symptom vocabulary because describing how you feel is half the battle. If your nose is completely blocked and you can't breathe through it, we call that a stuffy nose or congestion. If liquid is coming out of your nose constantly, that's a runny nose.
If your head is pounding, that's a headache. If your muscles hurt, we call those body aches. And if your body temperature is higher than normal, you have a fever. So you might walk up to the counter and say, "Excuse me, could you recommend something for a fever and a very stuffy nose?"
The pharmacist will likely point you to a specific box and say something like, this is a very effective decongestant. Now, what if you have a known allergy? You definitely need to communicate that before buying medicine. You should say, I am allergic to penicillin, or I have a peanut allergy. You can also ask, does this contain aspirin? I'm allergic.
That's a great point. Safety first. Okay, let's shift gears. Let's talk about the other side of the pharmacy, dealing with prescriptions. You went to the clinic, the doctor examined you, and they gave you a prescription for antibiotics. Now you're at the pharmacy counter. What's the first thing you say?
If you have a physical piece of paper, you approach the counter and say, hi, I would like to drop off this prescription, please. Or simply, I need to get this prescription filled. The verb we use for preparing a prescription is to fill.
Yes, dropping off and getting it filled. Now, if your doctor sent it electronically through a computer system, you wouldn't say drop off. You'd approach the counter and say, hi, my doctor called in a prescription for me, or my doctor sent a prescription over for me. They will then ask for your name and usually your date of birth to verify they're pulling up the correct file.
Once they have your information or your piece of paper, you'll want to know when you can actually get your medicine. You don't want to just stand there staring at them if it's going to take 2 hours. So you ask, how long will that take? Or when will it be ready?
The pharmacist will usually give you an estimated time. They might say it'll be about 15 minutes, you can wait here if you like. Or if they're very busy, they might say it won't be ready until this afternoon. Could you come back after 3?
Exactly. So you go run some errands or you sit in the waiting chairs, and eventually they call your name. Now we're at the pickup stage. This is arguably the most important part of the entire process, because this is when the pharmacist gives you the instructions on how to actually take the medication safely.
When you go to pick it up, they will usually ask your name and date of birth again, just to be absolutely sure they're giving the right drugs to the right person. Then they'll review the label with you. The vocabulary for dosage and instructions can be very specific, so let's break down the most common phrases you'll hear.
The first thing is the dosage amount. How much do you take? They will use phrases like take 1 tablet, take 2 capsules, or take 1 tablespoon. Remember that tablets are the hard, flat pills, and capsules are the little plastic-like shells with powder inside.
Then they'll tell you the frequency. How often do you take it? They might say take 1 tablet twice a day. They might say take 1 capsule every 8 hours. If they say every 8 hours, it means you literally need to space it out around the clock, even if it means setting an alarm at night.
Another incredibly common instruction is regarding food. Some medicines can hurt your stomach if it's empty, so the bottle will say, and the pharmacist will tell you, take this with food or take this with meals. Conversely, some medicines don't absorb well if there is food in your stomach, so they will say, take on an empty stomach.
Paying attention to these details is vital for the medicine to actually work. The pharmacist will also warn you about side effects. Side effects are the unwanted secondary reactions your body might have to a drug. The most common warning you'll hear is this medication may cause drowsiness.
Drowsiness means feeling very sleepy or tired. If a medication causes drowsiness, you will often see a sticker on the bottle that says, "Do not operate heavy machinery," which is a formal way of saying, "Do not drive your car after taking this."
Other common side effects they might mention are nausea, which means feeling like you need to vomit, and dizziness, which is when the room feels like it's spinning. If the pharmacist mentions a side effect and you don't understand the word, you must ask them to explain. Do not just nod and smile. You can say, "I'm sorry, what does drowsiness mean?"
Before you leave the counter, it's also a great idea to ask a couple of proactive questions, especially if you take other medications. A fantastic high-level English question to ask is, are there any interactions with other medications I'm taking? An interaction is when 2 different drugs mix in your body and cause a bad reaction.
That's a brilliant question to memorize. Another amazing question, especially if you're paying out of pocket and don't have extensive health insurance, is about generic brands. Pharmaceutical companies invent a drug and sell it under a brand name, which is very expensive, but after a few years, other companies can make the exact same chemical formula, and these are called generic brands, which are much, much cheaper.
So, when you're dropping off your prescription, you can ask the pharmacist, is there a generic version available? Most of the time, the answer is yes, and it can save you a significant amount of money. The active ingredients are exactly the same.
This is also true for over-the-counter medicines. You can buy the expensive, heavily advertised brand of ibuprofen, or you can buy the pharmacy's own store brand of ibuprofen for half the price. They will work exactly the same way.
I think it is time we put all of this wonderful vocabulary into action. Let us do a comprehensive role play. I will be the pharmacist standing behind the counter, and you will be a customer who has a prescription to fill, but you also need to buy some over-the-counter medicine for a different issue.
Sounds like a realistic scenario. I will walk up to the prescription drop-off counter. Here we go. Excuse me, hello. I need to get this prescription filled, please.
Hello there. Certainly. Let me just take a look at that piece of paper. Okay, I see this is for amoxicillin. Have you filled prescriptions at our pharmacy before?
No, this is my first time here.
Not a problem. I'll just need to get a few details from you to set up your profile. Could I have your full name and date of birth, please?
Yes, my name is Alex Carter, and my date of birth is October 14th, 1990.
Thank you, Alex. And do you have any known drug allergies that we should keep on file?
No, I don't have any allergies.
Excellent. Well, I can have this antibiotic ready for you in about 20 minutes. Would you like to wait in the store or come back later?
I'll just wait here in the store, that's fine. Actually, while I'm waiting, could I ask you for a recommendation?
Of course. How can I help?
Besides this dry ear infection that I need the antibiotics for, I've also had a really dry, irritating cough for the past 2 days. It is keeping me awake at night. Could you recommend something for a dry cough?
I can certainly help with that. Since it's a dry cough and it's keeping you awake, you'll want a cough suppressant rather than an expectorant. An expectorant brings up mucus, which you don't need right now. If you go to aisle 4, right next to the tissue boxes, look for a blue bottle called Nighttime Cough Relief. It contains a mild sedative that will help stop the tickle in your throat and allow you to sleep.
Aisle 4, the blue bottle. Thank you. I will go grab that while I wait for my prescription.
Perfect. Just bring it back here to this counter when you are ready, and I can ring everything up for you at once.
Okay, I'm back. I found the cough syrup, and hopefully my prescription is ready now.
Yes, it is. Let me just scan this cough syrup for you first. All right, and here is your prescription for the amoxicillin. Let's go over the instructions really quickly to make sure everything is clear.
Great, thank you.
Your doctor has prescribed a 10-day course. You need to take 1 capsule twice a day, preferably roughly 12 hours apart. So, for example, 1 with your breakfast at 8 a.m. and 1 with your dinner at 8 p.m.
Okay, 1 capsule twice a day with food.
Yes, taking it with a meal will help prevent any stomach upset, which is a fairly common side effect of antibiotics. The most important thing, Alex, is that you must finish the entire bottle, even if your ear starts feeling completely better after 3 or 4 days. If you stop early, the infection could come back stronger.
I understand. I will take all of them until the bottle is empty. Oh, one question. Is it safe to take this cough syrup at the same time as the antibiotics? Are there any interactions?
That is a very smart question. Yes, they are perfectly safe to take together. The cough syrup only affects your nervous system to suppress the cough, while the antibiotic is fighting the bacteria in your ear. There is no negative interaction between the two.
Fantastic. Thank you so much for explaining all of that.
You are very welcome. Your total today for both items comes to $24.50. Will you be paying with cash or card?
I'll pay with a card, please. Here you go.
Thank you. Here is your receipt, and your medications are in this bag. I hope you feel much better very soon.
Thanks again. Have a good day.
And scene. That was a really excellent example of a complete pharmacy transaction. We covered everything from dropping off the script, asking for OTC advice, clarifying dosage instructions, and even checking for drug interactions.
I think the most important takeaway from that role play is that the patient, Alex, didn't just passively take the bag and walk away. He repeated the instructions back to the pharmacist. Okay, 1 capsule twice a day with food. That simple act of repeating the information guarantees that you understood it correctly.
It really does. Pharmacists appreciate it too. They want to know you're going to use the medications safely. Another thing to notice is the phrase the pharmacist used regarding the antibiotics. You must finish the entire bottle, or sometimes they say, finish the entire course.
That is specific to antibiotics, but it's a phrase you'll hear very often in English. It means you can't just stop taking the pills when you stop feeling sick. You have to take all 10 days worth, or however many days the doctor prescribed.
Exactly. Now, let's touch on a few other specialized items you might need to buy at a pharmacy, just to broaden our vocabulary a bit further. Let's say you have a cut on your finger and you want to prevent it from getting infected. What are you looking for?
You would be looking for first aid supplies. You'd probably want to ask for an antibacterial ointment. Ointment is a very specific medical word. It means a thick, oily cream that you rub onto your skin. We don't usually say antibacterial cream. Ointment is the more standard term.
And to cover the cut, you would need a bandage. In American English, we almost universally use the brand name Band-Aid. It has become a genericized trademark. People will say, "Do you have a Band-Aid?" even if they're buying a generic store brand. In British English, they are called plasters.
What if you sprained your ankle while jogging and it's swollen? You wouldn't want a bandage for that.
No, you would ask the pharmacist for an elastic wrap or an ACE bandage, again using a common brand name in the US. You might also ask for an ice pack to bring down the swelling. Swelling is when a part of your body becomes larger and rounder than normal due to injury or illness.
Let's look at one more common situation. A lot of people suffer from seasonal allergies, especially in the spring when there is a lot of pollen in the air. Their eyes get itchy and they start sneezing uncontrollably.
For that, you need an antihistamine. That's a big scientific word, but it's the standard English word for allergy medication. You can ask the pharmacist, "Could you point me to the antihistamines?" Or more simply, "Where is the allergy medicine?" They will direct you to pills or perhaps eye drops if your main symptom is itchy eyes, or a nasal spray if you are very congested.
Drops and sprays are good delivery methods to know. We don't drink eye drops, we put them into our eyes drop by drop, and we spray nasal spray into our nose.
Let's review some of the core verbs we've used today, because how we consume the medicine is just as important as what the medicine is. The most common verb is to take. We take a pill. We don't say eat a pill or drink a pill. We take it.
If it's a liquid medicine like cough syrup, we still use take. Take 2 teaspoons of cough syrup. We might also use swallow. Swallow the capsule whole with a glass of water.
If the pharmacist says swallow whole, that is a very important instruction. It means you should not break the pill in half, and you definitely should not chew it. Some pills are designed to release their medicine slowly over many hours, and if you crush or chew them, you get all the medicine at once, which can be dangerous.
Conversely, some medicine is specifically chewable. You'll see this a lot with vitamins or children's medicine. The bottle will say chewable tablets. In that case, you must chew them up before swallowing.
And what about medicines that you dissolve in a glass of water? You'll often see these for vitamin C boosts or cold remedies. The instructions will say, dissolve 1 tablet in a glass of water and drink immediately.
Finally, for things like the antibacterial ointment we mentioned earlier, or a muscle rub for an aching back, the verb is to apply. Apply the ointment to the affected area twice a day. You can also use the verb rub. Rub the cream into your skin.
We have covered so much ground today. We started by navigating the layout of the pharmacy, dividing it into over-the-counter and prescription areas. We practiced describing our symptoms and politely asking the pharmacist for recommendations, using phrases like, "Could you recommend something for?"
We walked through the entire process of dropping off a prescription, asking about wait times, and picking it up. We broke down the complicated language of dosage instructions, how much to take, how often, and whether to take it with food.
And we learned how to protect ourselves by asking about side effects like drowsiness, questioning potential interactions with other drugs, and even saving a little money by asking for generic versions of brand name medications.
I feel incredibly confident that any of our listeners have to visit a pharmacy in an English-speaking country tomorrow, they're going to handle it brilliantly. But just like we say at the end of every episode, passive listening is not enough. You have to practice.
Absolutely. Go back and listen to the Rolte section again. Pause the podcast after I ask a question as the pharmacist and practice saying Alex's lines out loud. Get your mouth used to pronouncing words like prescription, antibiotics, and drowsiness.
Muscle memory is the key to fluency. The more you speak these phrases in the comfort of your own home, the more naturally they will flow when you're standing at the pharmacy counter feeling under the weather.
Thank you all so much for spending your time with us today. We know English can be challenging, but every time you tune in, you're making a massive step forward in your learning journey.
Stay healthy, keep practicing your English, and we'll be right back here with another essential topic in our next episode. Goodbye, everyone.
Bye. See you next time.